our organization to start that process. We also, the past year and a half, have been able to really give a lot of focus and attention to the needs of caregivers. And those needs are ever changing as this group and largely the community is aware that those needs are great. And so we've been able to develop web-based educational programs as well as virtual and in-person support groups for our caregivers. And we've got a lot more in the pipeline that we're excited to roll out. One project that I'm personally excited about is our e-series, which is an educational podcast series aimed at engaging our community, exploring relevant topics, and educating the community on how to engage with our organization. And it's been really exciting. We've had a lot of great speakers, guest speakers from the community, a lot of great content we've been able to share, both highlighting the joy and the gains that come from the caregiving experience, but also the struggles and the loss that accompany that experience as well. We've been able to really hone in on both sides of that experience, and it's been a really great service for me to learn from, but I think for our community as well. You can subscribe to that podcast, the e-series, anywhere you would listen to podcasts, so SoundCloud, Apple Podcasts, Google Podcasts, and we encourage you to take a listen if you're interested. And if the content strikes you, give us a follow, and you can be up to date on future conversations. As the director of community engagement education, I also supervise our volunteer department. And so I would be remiss if I didn't give our volunteer opportunities a plug. If you are ever interested in coming alongside a hospice patient or serving our organization in any way, we've got a lot of different opportunities. You can find those all on our website. At www.hospiceofthepiedmont.org. And actually that main hub it'll put you to the e-series, volunteer opportunities, how to make a referral, our caregiver, initiative, and other resources. So that is all I have to share. It's a lot, and I appreciate the opportunity to partner with you all and help support this great group as a program sponsor.
Thank you so much, Ryan, for being a program sponsor tonight. And it sounds like after a lot of the information you just shared that you are a great community resource. So it's very fitting for tonight's topic. So again, thank you for supporting ACAP tonight.
You're very welcome. I appreciate the time.
Thank you. I would like to go ahead and turn it over to tonight's presenters. Our presenters tonight will be presenting on finding reliable resources on the internet and in the community. This program will help participants use web-based and community services wisely by presenting strategies for evaluating and using web-based and medical resources. Resources can play a huge part in navigating your parents' and loved ones' care, and it can have a huge impact on knowing what is available and can benefit your loved ones. We have two wonderful speakers with us tonight, and I would like to start by introducing Bob Cleveland. Bob Cleveland has over 30 years of experience working with older adults and their caregivers, helping them with resources and services to meet their needs. He was the Director of Social Services for Continuum of Care Retirement Community in his hometown of Rockford. He left the CCRC to work for Northwestern Area Agency on Aging. In his 15 years there, he directed information and assistance services and piloted one of the first of two aging and disability resource centers. In 2012, after relocating to North Carolina, Bob was hired by the Piedmont Triad Regional Council Area Agency on Aging to work with county aging planning committees that allocate funding for aging services. Bob also participates on a team looking for ways to connect healthcare with community-based support to address social determinant of health needs. Again, thank you, Bob, for being here with us tonight, and I would like to turn it over to you to start your presentation.
All right. Well, again, thank you so much for allowing me to be here this evening. I really appreciate the opportunity, and especially to speak to all the caregivers. I have a special place for caregivers. My parents were caregivers to my grandfather, who unfortunately was diagnosed with Alzheimer's, and saw all the care and needs that they have over years. So I just want to start off by saying I think there are a lot of caregivers, and many on this call potentially, that started off caregiving because they saw something needed to happen. They didn't necessarily have a plan in place, and they didn't know about the available resources. So today I thought we'd want to start from the beginning before we jump into what are some of the resources, and really, figure out what you need to do before you even pick up that phone. So first of all, you needed to figure out, what you want to know about before you pick up the call. So the first thing you need to really think about is who needs the assistance or support. Is it the older adult that you're caring for that needs the support? Is it you as the caregiver that needs support? Maybe a break, or you just need some information for yourself, or is it both of you need some assistance and support? So you need to determine that. The next thing that you need to determine is what kind of assistance or support that you need. And it's really important to be clear and concise about that. So when you say what assistance is, I need help with bathing my mom. I need help with getting her meals. I need help for myself so that I can go do some things I need to do, and yet someone be here to watch her and make sure she's safe. So again, when you're thinking about this, these are things that you should gather before you even make that call. So the next thing is to determine, where does the need exist? Because some services are available on a county level, maybe in a city level, in a home versus a long-term care facility. So where does that need exist? The next thing you need to think about is, how soon do you need it? Is this something that this is an emergency, I need it in the next 24 hours? Or I see the need coming, but I'm good maybe for a month. I don't need it quite right away, but I'm doing some planning ahead. And then finally, what resources are at your disposal? So here, we're thinking about those financial, income, asset, insurance type things. What is at your disposal to potentially pay for services if something isn't available at no cost, or community-based services have wait lists? And again, different programs, some will look at income, some will look at assets, some won't look at any of that. And when we look at our aging programs, we don't consider income and assets. And then finally, what are the social supports? Family, friends, neighbors that can help with transportation, bringing meals. So all of these things you kind of need to know before you make that call. So when that person at the other end of the phone is asking you, they're going to ask some of these questions. When do you need it? How soon you need it? What resources do you have? So it's best if you're prepared ahead of time before you make that call. Just jot everything down on a sheet of paper so you have that ready to go. So the next thing would be to get started. And when you're trying to find the right services and supports, obviously you need to ask questions, right? People on the end of the phone are going to ask you questions, but you need to have questions that you're going to ask to find out about the services and the resources that are available to you. One thing that doesn't always happen, and I know I sometimes not do the best at it, but you want to make sure that you're capturing the name of the agency that you're calling and the staff person with whom you're speaking. And you also want to make sure that you capture their contact information, so their phone number, their email address, in case you have to go back to them with additional questions. So again, you want to keep a sheet of paper, something handy where you can take notes, or take it right on your laptop if that's the way you prefer to operate. But you want to make sure you're capturing that information. So next we look at the questions. And these are questions, I believe the PowerPoint will be available. And Bruce and Michaela can address that later, but things you want to ask. What's included in the service? And again, you want to ask for specifics. So for example, with in-home aid, There are a lot of in-home aid agencies out there, but not all providers offer the same services. There will be some basics like bathing, dressing, toileting, etc. But some agencies might say we don't offer X particular service. So you want to ask about what's included. The next thing you want to ask about is, are there any eligibility requirements? What are they? And so you see below there may be age requirements. Someone maybe have to be 60 or older. Is there an income guideline? Maybe that says you have to be at or below poverty level income, or 120% of poverty, whatever that may be. Assets, money in the bank, stocks, bonds, that type of thing. If you're looking at low income programs like Medicaid, they're going to ask all three of those first three: age, income, and assets. Are they a veteran? Because there may be some veteran services available to them. What insurance do they have? Whether it's not only their health insurance, but do they have any type of long-term care insurance? And when we say long-term care, policies have changed over the years to include not only nursing home or assisted living, but even some home care. And then eligibility by location again. So it says, well, if you live in Guilford County, you can get this service. But, if you live here, but your caregiver lives in Virginia, the person you're caring for is in Virginia, you could get caregiver services here, but you'd have to call into Virginia to get them services in their locale. Eligibility as far as Medicare. Medicare covers short-term recovery, not long-term care. And there's been a lot of confusion about that. So again, when you're looking at whether the insurance or whatever service, especially in healthcare, you want to make sure what that covers. And again, there's people that you can ask about that. Another question to ask is, how do I apply? Is there an online presence? Do I have to fill out a paper copy? Does someone have to come to my home to do an assessment of my aging parent in order to qualify them or get them into the service? What information do I need to complete for the application? Again, you may need some of this back to this eligibility. I need to show their driver's license or some form of ID, proof of income, etc. So how do I apply? What information do I need? And then how long will it take to process the application? And this is a different question than how long will it take to receive the service. This is about, well, it takes us 30, 60, 90 days just to process the application. And once we do that, then we'll be in touch. So again, applying for that service these are all questions you want to ask. Other questions to ask. Again, are services available now, or is there a waiting list? And if so, roughly how much time do I have to wait? Is this a month-to-month thing, or is this it's probably 6 months before I can get a service? Another question is there a minimum number of hours or days required? So if you're looking at in-home care, I know there are a number of agencies out there that have hour limits. So they might have a 2-hour limit, a 3-hour limit, or a 4-hour limit. To say that if we come to the home, we want to spend some time there and not have to come out 3 days a week just for an hour. As far as adult day care, most of them don't have a minimum number, but you do want to ask. Are there any limits as to how much assistance can be received? So again, I've had people say, well, I need someone to come in and provide 24/7 care for my mom. There aren't a lot of there aren't a lot of home care agencies that offer 24/7 care. So they may say, well, we can do up to X amount of hours per week, or in terms of the aging programs, they typically have up to 10 hours a week for a level 3 in-home care level. So with that, you want to find out, are there any limits? And then finally, are there any other suggestions about where I can find help? So if you can't help me, where else might you suggest that I go to receive assistance that I need? So the next thing is, what we're here to talk about is also where to find those services and support. So of course, I work for an area agency on aging. I've worked for an area agency for over 25 years, both here and in Illinois, but we provide information more on a regional level. So if you were to talk to us about what I would call federal programs or state programs and some local resources, we can answer those questions. But we don't necessarily know on the county level what church provides a men's group that might go out and do minor home repairs. And we'll talk about that in just a minute. So area agencies, we are places to call. And again, we don't charge for those services. And then we also have ombudsman. Ombudsman is a Swedish word that means advocate. And the ombudsmen are basically there to help nursing home residents, assisted living residents, family care home residents, make sure their rights are being upheld, making sure they have a quality of life in that facility. So people can call on us for those services. Next is information referral. And this is where we encourage people, if they call here and we can't fully meet their need here or get them the resources, we would send them on, and they're an older adult, we send them to Senior Resources of Guilford. Senior Resources is funded to provide information referral. So they have a computer database of all different kinds of resources, whether it's housing, whether it's facilities, in-home care agencies, you name it. They keep a laundry list of all different kinds of resources. And again, they offer what I would call informal resources. These are the resources that aren't an official program per se, but it might be this church has a caregiver home nursing program. I'm not using the right term there, but they would also have, again, as I said, mentioned that maybe this church has a men's group that will go out. Doesn't have to be just men, but would have a group of people that would come out and maybe fix some steps or fix something else in the home that the person can't do for themselves. So again, those informal types of supports and services. And then anyone, anytime can call NC 211, and that also acts as an information referral line. However, again, they tend to know more of the formal supports as opposed to the informal supports. So other places where you can find information about services and supports, again, I would always go first to Senior Resources. That would be my first place that I go to if I don't know the answer. But churches, a lot of people go to churches and ask for help. Some churches have programs where they help people directly, maybe pay rent, pay a utility bill, something along that line. But churches also know about other resources in the community. County DSS offices also, their staff who work with Medicaid and Adult Protective Services, their staff also know, because they do case management for their clients. So they know about transportation services, and they know about the adult daycares. They know a lot of different services. So if for any reason you couldn't get a hold of us or Senior Resources, or you were in the Medicaid office talking to a case manager, and you had some other questions, they could potentially help lead you to some other resources. And then finally, hospital discharge planners. And these are the folks that often tend to get asked questions when mom or dad fell, they're in the hospital, and they're being ready to be discharged to a long-term care facility for rehab. But yet still some services may need to be in place where mom and dad comes home. And again, it might be, hey, they're in a wheelchair now, and I don't know how we're going to get them up the 3 steps to get them into their home. So we maybe need to get a ramp built, or we may need other assistive devices. Maybe they can't transfer and step over the bathtub, so they might need a transfer bench. So again, talk to your hospital discharge planners about local resources, etc. And again, I've listed just these. There are other places that you can get information, but none of these services here or resources sell anything. You know, their objective is to help you find information and resources. They're not out there as selling their service per se. And so many of these are trusted sources of information. So I want to talk a little bit about family caregiver services. Back in the year 2000, the Federal Administration for Community Living established the Family Caregiver Support Family Caregiver Support Program. which is the first time there was really a lot of attention turned to caregivers, because they realized that the bulk of the care in this country is really provided by many of the people in this webinar, people who are caregiving for their aging parents, grandparents, and providing that unpaid care, as opposed to an in-home aid agency going in to care for someone. And so with that, there's a lot of, been a lot more funding and a lot more programs put out in the community specifically for caregivers. Support groups, respite care. Again, you see educational programs, information. Some of these programs pay for incontinence supplies, Ensure, and some other nutritional products. So in Guilford County, family caregiver services are offered by Senior Resources of Guilford. Their caregiver specialist is Gail Lancaster, and you have her contact information here. And then Wellspring Solutions, their caregiver specialist is Jody Collada, and you see her contact information here. So each one of these offers some similar, but also a little bit different services in terms of caregivers. So again, a couple of resources there. The rest of the services, other than respite care, are going to focus on older adults. I'll get to those in just a minute. But respite care, I think hopefully everyone knows now, is that caregivers need a break. And if they don't get a break, caregivers' health often declines. And sometimes, and I've seen it happen over the years, where a caregiver's health declines faster than the person they're caring for. So it is extremely important that caregivers get time for themselves, time to get away, get a break. Some caregivers feel they don't ever have that opportunity. I don't even know how I would do that. But there are programs out there to help someone provide that respite for you, so that someone can go in, care for your loved one while you go get that break, whatever you need, whether it's shopping, whether taking a movie, take a nap, whatever that might be. But there are some services available in the community. The Connections Memory Club is offered by Wellspring. Senior Resources has a respite voucher program. And so again, you see here where it provides that in-home care, and then Senior Resources gives a voucher to pay for that. The Lifespan Respite Program is actually a program offered, of course, through the state of North Carolina. The High Country Area Agency actually runs this program for the state, but it reimburses caregivers up to $500 in a calendar year for respite care. And then Project CARE is Caregiver Alternatives to Running on Empty, is what CARE stands for. And it's a program specifically focused on helping caregivers of individuals with an Alzheimer's diagnosis. Again, there's case consultation and vouchers, and it's offered by the Duke Family Caregiver Support Program. And now we get to services for older adults. So we've already talked a little bit about in-home aid, and there's a variety of agencies out there. I think everybody may be aware, right now we're somewhat in a crisis of in-home aid, in where there's a lack of people in that workforce able to care for people. So there's a lot to be said that we need to do in this country to help draw people to this field. But I will say that there is services out there, but they can be more difficult to find, especially I would say over the last couple of years. But basically, with in-home funded services, through our agency, we help fund we pass through dollars for the Home and Community Care Block Grant. The state funds the Social Services Block Grant. Both of these provide services at no cost to the participant. And Guilford County Department of Health and Human Services is the agency that runs those programs. In the Home and Community Care Block Grant, there's 3 levels of care. One is basically no hands-on with the client, but it offers help with cleaning, cooking, laundry types of services. Level 2 and 3 get into more hands-on care, helping someone with their activities of daily living, such as bathing, dressing, toileting, where you need to have that hands-on assist with the individual. So Again, with those programs, no cost, but you do have to meet the guidelines, 60 and older. And then you also have to have an in-home assessment where they come in and look at what is the capability of the individual needing care. For people younger than 60, there's something called the Community Alternatives Program, or CAP, a disabled adult, where participants must be Medicaid eligible and be at risk for institutionalization. And if they qualify, then they get to choose the individual that they wish to provide their care. So there's a little more flexibility in the CAP-DA program than there is in block grant, for example. Guilford Department of Public Health runs that CAP-DA program. And finally, Veterans Aid and Attendance. For veterans who are 65 and older who served during wartime, they don't have to have served in the war theater. They could have been serving here in America. But as long as they served during wartime and they need assistance with activities of daily living, they may qualify for payments to help cover their expenses related to their caregiving needs. So there's a website there that you can go and find out some more information. This is one of the best kept secrets that not a lot of people know about. And they can get, if they qualify, depending on their need, right around $2,000 a month to help them pay for living in a facility or even bringing in-home care. Adult day care and adult day health programs are block grant programs. And these programs offer supervision. Adult day care is for people who basically need to be watched. They may have a dementia where they can't be left alone, but they really don't have maybe physical needs, where the adult day health programs are doing more. Maybe they're dispensing medications, maybe they're actually dispensing some sort of treatment to the individual. So these adult day care day health programs, and you can see the list of 4 facilities here. I will say about PACE of the Triad. PACE of the Triad operates a little bit differently in that they are a medical home for the people that qualify for that service. The people who qualify are dually eligible, Medicare and Medicaid. They're a great service, but they're not a traditional adult daycare in that sense. So you do see the memory centers at Wellspring and the Emmanuel Senior Enrichment. After Gateway is specifically for persons with developmental disabilities. Nutrition services. Home delivered meals and congregate meals programs provide a hot, nutritious lunchtime meal. During the pandemic, the meals were, many of them went to frozen meals, specifically for the congregate sites where we didn't want older adults congregating together, spreading COVID. And so those sites were closed, but people could still pick up a box of frozen meals once a week at those centers. Most of the centers are going back to bringing people back together. But the home delivered are really meant for people who really can't get out and about and need that meal. It provides 1/3 of the RDA. Senior Resources actually offers a restaurant voucher program. I believe it's in High Point at this point. I know they're looking to expand it for older adults who can get out and about and would enjoy the dining experience, but they have to order from an approved menu. SNAP is formerly food stamps, and eligible people who are lower income can receive a certain amount on an electronic benefits card to purchase their food items. Guilford Department of Health and Human Services offers that program. And then finally, food banks. There are a number of churches, organizations, et cetera, that make food available to people who have needs. Senior Resources of Guilford would have a list of that. There are a great many out there. And during the pandemic, there was a lot of money that came down because they realized people needed to be fed. And a lot of funding went into making sure there were food in the pantries, food in the meal programs, et cetera. Transportation is a big challenge. We know it's a big challenge because we hear from the medical community that the number one reason that people have bad outcomes after being discharged from a hospital is they don't get back and see the doctor 2 weeks after for their follow-up visit. And again, the number one reason they don't is they don't have access to transportation. So if you are dealing with a loved one who is having transportation issues, here's a list of organizations that provide transportation. I'm not going to read through all of them, but some of these are funded through the block grant, which is Guilford County Department of Transportation. Greensboro Transit Authority offers services within the city of Greensboro. There's Dial-A-Lift, and then Senior Wheels is a program through, I just lost their name, but they provide volunteer rides to non-emergency medical appointments. Actually, that's Senior Resources number, excuse me. And there are other organizations that provide rides for medical appointments, but these are non-medical. So somebody who needs to get out and get to the store. For home repair, there are a couple programs that offer home repair services, PTRC. We offer a housing and home improvement program. They also offer weatherization assistance, where they come in and help people save on their energy bills by checking the insulation, checking the ventilation, etc. Community Housing Solutions is a volunteer program where they help low-income homeowners. So while the housing and home improvement, the only requirement is age 60, weatherization is a lower income program, and Community Housing Solutions, based on their guidelines, operates for lower income folks. And then there's a Handy Helpers program that Senior Resources does. This is one of those volunteer ministries where they'll send folks in to help change batteries, change light bulbs, maybe do some other small repairs, yard maintenance, etc. And then senior centers. I think over the years, senior centers have gotten a bad rap because they think that, oh, that's just where all the old people go and all they do around is sit around and play bingo. And that's certainly not true anymore because one, during the pandemic, one of the things that our state required them to do was to make sure they offered virtual programming so that people who were homebound and encouraged not to come to the senior center during the pandemic could still participate in exercise programs, in coffee clutches, making sure that they had that opportunity to reduce that social isolation. So if you are caregiving for a loved one and you're at work, they're at home, they're still doing pretty well, but they could really benefit from some socialization, contact one of these senior centers. I will say that the John O. Harper Senior Center in Gibsonville is not, I think they're only open minimal hours during the day. So not really a fully fledged senior center, but the remainder of these three, check with them about what kind of programs, services they offer. You might find some things that your loved one would be interested in, and again, get some socialization. We heard a statistic during the pandemic that someone who is socially isolated has the same health risk as someone who smokes 15 cigarettes a day. That's pretty remarkable, just by being isolated. So strongly encourage you to help your older adults get connected to other people. If not you, certainly, but there's a lot of folks out there that need that connection. In terms of long-term care facilities, there's basically three levels. One, it was actually mentioned in my bio, a continuum of care retirement community. Some people call them life plan communities, where there are multiple levels of care. All the way from independent living all the way to nursing home. You have adult care homes, which are called assisted living, skilled nursing facilities, and some of those skilled nursings have memory care units. And I know we're finding more and more older adults who have need of a memory care unit. These facilities can be found on our website. You have the link there. If you go to that, each facility is listed, and it lists which of those take Medicare, take Medicaid, private pay, if they have a memory unit, et cetera, et cetera. So all that information is there. And again, our long-term care ombudsmen are really there to help people navigate their rights, making sure that they have a quality of life in long-term care facilities. And they also help people learn how to choose a good facility for their loved one. So you can call our office and talk to our ombudsman about that. So that is the end of my presentation. There are a ton of more services available in the community. But I hope, going back to the beginning of this presentation, I hope I helped you maybe think about how to plan, how to maybe plan ahead, but what information you need before you make that call, questions asked during that call, and again, just a variety of resources. So following the program, if you have any questions, you can certainly email me, look at our website, call me, be happy to help. So thank you.
Thank you so much, Bob, for all that information. And that slide deck available it moving forward. And introduce our next speaker, digital literacy librarian. She brings over 10 years of digital literacy at the K-12, years of experience in adult libraries around North Carolina. You're muted. There you go.
How about now? Okay, thanks so much.
You're good.
So thank you so much for having me here today. I really appreciate it. I wanted to say thanks also for the great resources earlier. I definitely took notes on some of the information presented earlier, so thanks so much. As with a lot of people in our community, I have people in my family who are also aging parents and family members. And so, this issue is something that we can start on as early as possible and have as much information available to us as possible. We have some essential skills that we need to engage in when we engage in health research. And that's most of what we're going to be talking about today. Let's say you get a new diagnosis for a parent or family member, or you have even a new diagnosis for yourself. Really, what skills we're looking at are learning to search, learning to evaluate, and then later learning to understand the information that we are finding within our research. So we're going to break these up into smaller parts, including where to start, using keywords, then later how to evaluate. And we're going to go through a quick practical example of exactly what I mean when I'm discussing these resources that we can use. So first off, when we talk about searching, we are drowning in information but starved for knowledge. This is a quote from a thinker and novelist, John Naisbitt. And I think it's very true, certainly in the realm of digital information and health information. Anytime you go on Facebook or even just reading an article on newspaper online, you see fat busting cures or stories about innovative treatments for chronic illnesses, and they're often both treated with similar weight in many cases, and so it can be difficult to understand exactly what is reliable and what is good information to take to a healthcare professional, or what is really something that should be ignored. So the first place that everyone starts really is often Google. And I'm not saying that Google is bad, because I use it just like everyone else all the time, but it's sort of a baby step. Everyone's first steps they're okay for getting around, but they're not really great for heavy lifting. They're not reliable. If I want to really find reliable information, I have to think about the source that I am accessing. So going to the source of information that I know is reliable can be helpful to getting information that is itself the most reliable. And when we're talking about health resources, we all know the name of well-known hospitals across our country, including Johns Hopkins, the Mayo Clinic, We can think about local resources such as conehealth.com, and we can also go to nonprofit resource areas such as nchelpinfo.org. And these are the sources, direct sources of information, and they help us to skip out on the resources that are going to be trying to essentially sell us something, trying to present information for their own interests. Now, I'm going to briefly, I'm not sure that this is going to, yeah, that's what I was afraid of happening. Sorry about that. So there are also illness-specific resources. For example, the National Kidney Foundation has a really informative website about kidney diseases. The American Diabetes Association has information about both type 1 and type 2 diabetes. And if you are in a situation where you're interested in learning more about clinical studies for any kind of illness, clinicaltrials.gov is a website that's very informative about clinical trials that are going on. You can find information about research that's happening right now and even enroll in trials that are near you. You really need to be aware of pollution. And by that, what I mean is that it's difficult a lot of time to tell the difference between something like an advertisement and an informative website. It can also be very difficult not to put your faith in what you might think of as cure-alls. I took one pill and now my fat is melting away. The snake oil salesman of the early 1900s is definitely back in our society right now, and it can be very difficult to understand what exactly is in the medicines that are being offered online, the cures, the diets, and so on like that. Also, I want to encourage folks to really lean on professionals. As much as it may be a blessing and a curse to go to a website like WebMD and type in your symptoms, it can really actually give you sort of the worst case scenario and the most serious condition. And that can be informative, but at the same time, an armchair diagnosis isn't really going to positively affect your health outcomes. It's always important to discuss things with a medical professional before you change a treatment plan or make a medical or a health decision. So, how do I start? If I can't use Google to just type in kidney problems, what do I do? Well, you can use Google, but you need to think about using thoughtful terms. Using medical terminology when you are searching for information is really helpful. Commonly, we might say, oh, my sugars are high when we're talking about our blood sugar. But searching for the word sugars is going to come up with a different result than searching for example, blood sugar or blood glucose. Don't be afraid also to look up something on a dictionary. Medline Plus has a fantastic encyclopedia that is really easy to understand and accessible. And I've included that link here that you can use to sort of side by side help you through more difficult medical texts. Also, there are search strategies such as using quotation marks to combine terms. Searching for CBD cancer comes up with a different result than CBD and cancer in quotation marks. And that's really important because when you're talking about illnesses and causative factors, or you're talking about treatments along with illnesses, it's important that you're looking at results that combine those two search terms rather than just individually. I don't want to get an advertisement for CBD oil for my dog when I'm searching for a scholarly or reliable source on cancer studies having to do with CBD. So I've been searching. I've got all these results. What can I do next? Well, you have to evaluate these resources. Rudyard Kipling said, "I keep 6 honest serving men. They taught me all I knew. Their names are what and why and when and how and where and who." These 5 Ws can really help you to boil down questions that you need to know about any online resource. And this is true whether it's medical information, health information, or where you're getting your news, where you are understanding any essential information, that it's important, that it is reliable. These can be questions that you should be asking. The first W stands for who runs or who has created this website or application, and can you trust that person? Organizations put things online often for their best interests, and it's important to know who is providing the information so that you can perhaps deduce what their best interest is. Are their interests really just to sell you a supplement, or are their interests really in providing information or resources to people suffering from an illness? What is the site or app promising or offering? Do its claims seem too good to be true? When was the information written or reviewed? Is it up to date? Where does the information come from? Is it based on scientific research? And finally, why does the site or application exist? Is it selling something? Really, another step that you can use, and I don't have a slide on this, but a very basic tool that you can use is the ending of the website. As you can see on my slide, I'm going to see if I can get my mouse. Yeah, here we go. This website, for example, is a government website. It's from the NIH, which is the National Institutes of Health, and it's information website, and you can also have this in the presentation to look at later. But it's a government website from the NIH about finding and evaluating online resources. So I know based on that .gov that it's a government website from the United States government. Other suffixes include com, which stands for commercial, org, which stands for organization, and mil stands for military, et cetera, et cetera. So each one of those can tell you a little bit of information that's helpful about the website that you are searching on. Now, how do we go about understanding the information? Well, I just want to use a little bit of a case in point. So this is Martha. She is a family member of mine, recently had a kidney disease diagnosis. She has type 2 diabetes, and this has led her to want to look to move into independent living. But as a family member of hers, I want to be sure that she's getting the best amount of care and that she and I can understand together what is happening. So I'm going to briefly stop sharing my screen, and then I'm going to reshare once I have this search bar up. If you'll give me just a second to do this. Okay, and now I share, and then I'm going to do this. Okay, so if I could get that back in screen, thank you so much. Okay, so as I said, one place that we can go to learn about kidney disease is kidney.org. So I'm going to go straight there. I'm going to start at the National Kidney Foundation because I know that they're a reliable resource. I typed that into my address bar and I went directly to the website. I can understand a little more about general information about kidney disease. And at the top, I can use the search terms to search for what I understand to be her diagnosis, which may be stage 2 kidney disease. Now, a tool like this will give me guidelines and understanding from this web page, general articles and blog entries about this. Well, it's not exactly what I'm looking for. So let's take a step back and start back at Google. Google.com, stage 2 kidney disease. Okay, so I'd like to draw your attention right here to this portion of the screen where it says add. A lot of times this is sort of a subtle acknowledgement that this entire entry right here is an advertisement. It's an advertisement for a prescription. Chronic kidney disease, or CKD, is another term for kidney disease. And this is a prescription treatment website. So I might go here thinking this is the first and most important information of the website. But actually, this is an ad. 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 Here we go. An information from the American Kidney Fund Stage 2 chronic kidney disease. And I've got something that's a little more informational. So I can use this now to understand from what looks like a reliable source, some different information about kidney disease. Now, how do I know it's reliable? Well, I can go to their homepage. I can go to the bottom of their homepage and scroll through some of these visuals. And I can understand that it's copywritten as we asked before. It's current. It's 2022. The American Kidney Fund Incorporated, all rights reserved. Okay. They're a 501c3. That means it's a nonprofit. They have upfront right here. Oh, look, it's from Rockville. They are upfront right here, all kinds of information about their organization. A reliable website should have this information front and center. They have a privacy policy, they have terms of use, and they have also an About Us page that I can look and find information about the organization. Again, I can find out where do they go? 97 cents of every dollar donated goes directly to patients and programs. What do they use their money for? Et cetera, et cetera, et cetera. This allows me to really be thoughtful about not only where I'm getting my information, but if I am choosing to support a cause, how is that money being spent? Let's also look at that Medline website. It is a government budgeted government financed encyclopedia from the National Library of Medicine, and it is just a straight up encyclopedia. I can go to K for kidney and go to kidney disease resources and find a list of nonprofits. I can also understand a little more about the kidney. So there are, as I said, a few really reliable websites that I highly recommend. I'm going to do that switcheroo one more time and go back to my presentation. Here we go. So again, as I start with the basics, I see that advertisements are the first thing that comes up in a lot of cases, so do be careful. But here are my most recommended resources, sort of in order of how much I like them. Medline Plus encyclopedia is a great place to start with information about just general, what is a kidney? What does it do? What is kidney disease? What does that mean? North Carolina Health Info also is a really great and very reliable resource that also provides information on providers here in North Carolina. It gives a lot of the same information, and then it also has an entire section on providers and hospitals. For example, in the event of a kidney that a kidney transplant may be necessary, it provides information like what hospitals in North Carolina provide transplant services. Johns Hopkins Medicine and Mayo Clinic obviously are well known. Cone Health is that local resource. They also provide general health information, but remember that when you're looking at a resource like Cone Health, really use that resource to find providers. Don't look for general kidney info on the Cone Health website. Think about using the right tool for the right job. Finally, as I provided earlier, kidney.org, diabetes.org, clinicaltrials.gov, all really fantastic websites. You can use Medline Plus's encyclopedia to find more pinpointed resources as well for any particular illness that you may want to research. There are organizations throughout the country that can be incredibly supportive, and also locally, as we had introduced earlier. So that's pretty much it for me. Again, I'm Blaine. Now, just doing a quick side note, if you do need help with technology with the basics of organizing or understanding how to do more research, please reach out to me. My information is on this slide, and we can sit down and make an appointment to understand a little more about general computer navigation. That's everything for me. I really appreciate it.
Okay, I think you may be on mute.
All right, there we go. Thank you so much for listening, both of you tonight, and the you shared. You really told us how to define those reliable resources. Eat out something that might not be loved ones, and those community resources about how to find those for our ones. Those are truly amazing resources in the community. Our sponsor tonight, Hospice of the ACAP. Next month will be on September 15th. This one and virtually. The location in Greensboro. The topic number is Battle of the Bills. Mitigating financial impact as loved ones. Our presenter will be Steve Arrington, and he has an estate planning. We connected with ACAP Guilford and ACAP. Please join us on our Facebook page. You can even send us an email at gmail.com. Again, a huge blame for just their resource with ACAP community. Everyone next month in person or virtual. Have a great evening.
Good night.